Hello, my name is Janelle, and I will be your nurse educator today.
Hello, Janelle.
I see that you have a chest tube inserted, Mr. Jones, and I'm here to talk to you about it today. Specifically, I will cover chest tube care, signs and symptoms to watch out for, fall risk factors and mitigation, such as removing potential tripping hazards, chest tube dislocation, and bandage inspection. By covering these topics with you, we hope to bring your attention to areas of safety and concern, as well as the proper care of a chest tube to reduce the chance of infection and dislodgement. I am glad that your wife was able to join us and is participating in this learning experience, Mr. Jones. Some of the topics I cover will be directed more towards you, Mrs. Jones, as you are actively participating in Mr. Jones's care, and this information may be hard for Mr. Jones to follow along. During this discussion, I will be prompting one or both of you to teach back the information I just presented to you. This will allow me to confirm your understanding of the materials I have presented. Mr. Jones, you currently have a chest tube inserted into your right side. This chest tube is draining the fluid that has accumulated around your right lung that was making it hard to breathe. The doctor spoke to you about this procedure before the insertion process and what it entailed. Could you tell me what you know about chest tubes?
The tube is in my chest to help me breathe.
That's correct. And you, Mrs.
His
Jones?
his chest tube is to help with the fluid in his chest so he can breathe better.
That is correct. Do you have any questions pertaining to what a chest tube is?
No. Nope.
Good. As you will not be discharged home until the chest tube is removed, it is important that we cover how to care for your chest tube properly and how best to reduce disadvantageous events.
Oh, okay.
As your chest tube will be managed by your nursing staff, there are only a few things you need to take into consideration pertaining to the care of your chest tube. These include: do not dislodge your chest tube, do not remove your bandage, and immediately call for help if your chest tube is dislodged.
Mama.
Additionally, please call for your nurse if you notice any kinking in your tubing, sudden onset of pain or bleeding, or if your tubing gets disconnected. If there's anything that causes you concern regarding your chest tube, use your call light and bring it to our attention. Following along so far, Mr. and Mrs. Jones?
Yes.
Okay, good. Could you please teach back to me what I just covered with you in relation to chest tube care, please, Mrs. Jones?
Yes. Do not dislodge the tube. Do not bend the tube. Do not remove the bandages. And if you notice any bleeding or any other thing that doesn't look right, call instantly for the nurse.
Wonderful. Next, regarding your bandage. While your nurse will be in charge of inspecting and changing your bandage on a schedule ordered by your doctor, there are instances where a dressing change or inspection may need to be done sooner. Please tell your nurse if you notice a foul-smelling odor coming from the insertion site, see green pus or discharge in or around the site, any bleeding, or if the bandage starts to come undone. Some of these findings may indicate an infection and can seriously affect your health. Mrs. Jones, would you mind teaching back to me what instances would make you call the nurse in regard to the care of Mr. Jones's bandage?
Yes. If I smell anything foul, if there is pus coming out of the wound, if it's bleeding, if the bandage might came loose, that would be a good time to call the nurse to have it reassessed.
Perfect. Thank you. The next step in this teaching process is to go over some signs and symptoms that should prompt you to contact your nurse. Should Mr. Jones experience any difficulty or discomfort of breathing, sudden rise in pain, pounding heart rate, increased temperature, or change in mentality, such as confusion, agitation, or restlessness, please contact us. Some of these symptoms may indicate a serious change in Mr. Jones's health and will require a nurse to assess his situation. Would you please teach back to me some signs and symptoms that would prompt you to contact the nurse, Mrs. Jones?
Yes, if he has difficulty breathing, if he has sudden pain, if he doesn't act right, he doesn't respond properly when I talk to him, and his mental state is kind of confused, he gets agitated or restless, then I would call the nurse to have him reevaluated.
Well done. Lastly, we will cover fall risks for Mr. Jones. Due to your age, Mr. Jones, and that you currently have a chest tube inserted along with 2 IV lines, you are at increased risk for falls. Currently, your doctor has orders for you to stay in bed until the end of the day. This means no getting up even when you have to use the restroom. A bedpan will be provided for you. However, in your plan of care, these restrictions will slowly be lifted depending on your level of healing. Therefore, I will teach you how to reduce fall risks now and again once those restrictions are lifted. Firstly, you should use your call light before trying to get out of bed so as to receive assistance. This is true for you too, Mrs. Jones. Please use the call light to receive assistance with mobility rather than trying to help him by yourself until instructed otherwise. Mr. Jones, never try to get out of bed by yourself as there is an increased risk of tube dislodgement and falling. It is important to make sure that tubing is not dislodged by taking the IV pole and chest tube atrium with, and that the tubing slack is appropriately controlled. Always wear non-slip footwear, such as the hospital socks provided. Use your walker. Miss Jones, as you stay with Mr. Jones most of the time, it is important that you keep the space tidy in his room so as to reduce tripping hazards. This means placing bags, pillows, or other miscellaneous objects that are on the floor onto a raised surface. Reducing clutter always helps. Having a clear path to the bathroom is also really important. Miss Jones, would you mind reiterating some of the ways that can help reduce the chance of Mr. Jones falling, please?
Stay in bed. Never try to get out of bed by himself. When he gets out of bed, that he has assistance, especially if he has an IV and he needs to take the pole with him. It's better to have 2 people so he doesn't have to struggle with it. He doesn't want to bend the tubing. He wants to control the slack in the tubing. And specifically, don't wear socks, wear slippers so you can fall and slip. And keep the hospital room tidy. Good housekeeping helps, no tripping hazards. And I think that would probably keep him from falling too easily.
Well done. There's just a little bit of a correction. We do provide non-slip hospital socks. If he has slippers, he can wear those as long as they don't fall off his feet. But everything else was correct. Thank you. Now, Mr. Jones, would you please tell me what you would do if you wanted to get out of bed?
I would call for help.
Good. And why would you need assistance?
I have a tube in my chest that's helping me breathe and IV lines in my arm.
That is correct. So, I have covered chest tube care, signs and symptoms to watch out for, fall risk factors and mitigation, such as removing potential tripping hazards, chest tube dislocation, and bandage inspection with you today. Did you have any questions?
Nope.
No.
Both of you, Mr. and Mrs. Jones, were able to demonstrate your understanding and meet the goals of this learning objective according to your abilities. According to my notes, both of you learned well with written materials and videos, so I have prepared some for you to peruse in your own time. I will be back later today on my rounds and can answer any questions you may have regarding this new material or anything else. Before I step out, I will go over how to properly arrange the room with you, Mrs. Jones. Thank you for your time today.
Thank you so much.
Yeah, thank you.